Because of the stitches from the cesarean, holding Stephen across my lap to nurse was a little uncomfortable. So I used what they refer to as the football hold, I believe, and we both were more comfortable.
Ready in a minute.
Okay.
It is important to vary positions for breastfeeding in order to prevent nipple soreness as well as neck and back strain. Whether you've had a cesarean or not, the football hold is a good position to use from time to time. Tuck your baby's legs along your side toward your back and support his head with your hand. Place a pillow or two under your forearm to keep the baby close to your nipple. In the early days at home, if you've had an episiotomy, sitting up for every feeding may be uncomfortable. You might try nursing while lying down in bed, a position that is especially convenient for night or nap time feedings. Just selecting the right chair can make a difference. One with armrests helps you to hold your baby close without putting stress on your arm and back muscles. A place to put your feet up helps you to relax and makes it easier to keep your baby close to you. Your own comfort during feedings is important. If you are relaxed and if your surroundings are as calm and comfortable as you can make them, your letdown will work its best.
Ready to eat? Okay, let's go eat. Yes. Yeah, almost ready. Yeah, you get something to eat now.
Poor baby.
Mommy's ready for you. There you go.
In the first weeks of life, it may seem that your infant does little more than sleep and eat. While his stomach is so small, he will not need to suck very long before he's full, but he will need to nurse frequently. No newborn follows a predictable or regular feeding schedule, but nursing every 1.5 to 3 hours is about average for breastfeeding infants, with intervals varying from baby to baby and day to day. Demand for more frequent feedings during the late afternoon is common. Most babies go a little longer between feedings during some part of each day, usually, but not always, at night. Because breast milk is so easily digestible, some breastfed babies may need to nurse as frequently as every 1.5 hours during their first month of life. It is best to feed your baby on demand, that is, whenever he's hungry. Sooner than you think, you'll be able to tell a hunger cry from all the other cries. But early on, when you're not sure, it's probably best to offer food. When you first begin breastfeeding, gradually increase the amount of time you nurse at each feeding. In the beginning, short but frequent feedings will help to build your milk supply. As the breastfeeding process gets underway, your baby will determine the amount of time he needs to suck naturally. There is no need to limit the length of feedings if you are comfortable and if your baby is happy sucking.